So before we go ahead, any of you can tell me what is stress and is it normal to have stress? Anyone? Yes, correct. Very good. You want? बराबर. बट वो अपने आप से आना चाहिए कि पेरेंट्स ने प्रेशर डालना है, टीचर्स ने प्रेशर डालना है, चलो करो अभी पुश करना है, ऐसा करना है. ओके, करेक्ट. राइट. You wanted to say something? Yes. So a lot of things are affected. So when you can't concentrate, when you feel nervous, anxious, right? You're worried about something, right? All the last 2 years, 3 years, whatever that you were studying, you were worried, अरे ये score आएगा कि नहीं, मिलेगा कि नहीं, मिलेगा तो कहाँ पे मिलेगा, उसमें भी stress ना, कौन सा college मिलेगा, है ना? So as what's your name? He already said that it is normal. We do require some amount of stress. So as you all have said already, it's a reaction people have to excessive pressure or any other types of demands that are placed. Like last few years we had a demand that we reach a score, crack that NEET and get into a medical college, right? Or it could be any other demand or pressure. So it arises when one worries that one can't cope. ऐसा टाइम आया था कि नहीं पिछले 2-3 साल में, ये नहीं जम रहा है यार, मुझे छोड़ दूं, अच्छा है, ये नहीं होगा मेरे से, है ना? बिकॉज यू वर वरीड कि इतना कर रहा हूं लेकिन वो जो बीच में एग्जाम्स होते रहते हैं उसमें ऐसा आया, इस टाइम मेरा स्कोर ये आया, ऐसे जमेगा, वो नीट में कैसे क्रैक करूंगा. या फिर कोई फ्रेंड रहता है ना, उसने कुछ क्लासेस के एग्जाम में क्रैक मारा, मेरा कम आ गया, ऐसा भी होता है ना, कि मेरे को जमेगा कि नहीं, ये जो फाइनल नीट तक मैं जाऊंगा कि नहीं, कितना मिलेगा, है ना? सो यू फील यू कांट कोप, दैट्स व्हेन यू आर स्ट्रेस्ड, राइट? एंड इट इज आवर ओन एक्सपीरियंस, मीन्स वी फील इट इनसाइड आवर बॉडी एंड माइंड. It can either evolve us if it is the right amount of stress, as he said, or it can destroy us if it is too much of stress, right? And if it is right amount, it will give us strength to go ahead, or it will tire us and we will say, nahi, mujhse nahi hoga, right? So, do we need stress? Yes. We need an optimal amount of stress. Now, what is optimal amount? If there is no stress at all, also your performance will go down. An optimal amount, just right amount. Because कुछ भी नहीं, हाँ एग्जाम बाद में 2 साल के बाद है, अभी चिल मारो, ये देखो, वो करो, ऐसा किया तो भी नहीं चलेगा ना, परफॉर्मेंस नहीं होगा. एंड बहुत ही ऐसा, अरे 2 साल है, कैसे होगा, इसने तो रिपीट मारा था, इसका ये स्कोर आया था, ऐसा किया, ऐसा करके पैनिक होके भी वो परफॉर्मेंस नहीं होने. Right? So optimal amount of stress is required so that it helps us grow, and it also creates some amount of tolerance in us. We are able to tolerate certain things. Even if there is failure on the way, we can cope with it and go ahead. Right? And it gives us a vision that if I put in this much effort, I can do this. So anything that comes, see, right now you just joined medicine. Now there will be all kinds of exams, tutorials, vivas, term exams. Then your clinical postings will start. Then the ward, term end exams, ward exams, all kinds of different exams. No MCQs here. Right? There will be practical exams where you will have to perform something, show something. So all this is coming and it's all new. So is it stressful? No. You will learn new things. Even when you were in school, when you did not know about this NEET, but you managed it because you practiced, right? Similarly, you will manage this also. So this normal or optimal amount of stress, we call it eustress, okay? Which is a positive influence on us. It moves us ahead, compels us to action and gives us a new perspective. If it becomes excess, then we call it distress. Okay? So what we want to have is eustress, not distress, because then it will cause various physiological issues leading to health problems. It will make us angry or anxious or depressed, and that will also cause interpersonal issues, and it will be a totally negative influence. So we don't want to go towards distress. So what causes stress and what are its effects? To discuss that, I will now invite Dr. Nishant Das, our assistant professor, to take you through this. Thank you.
That we need a certain amount of stress to go about our lives. So it's just like how a rocket is propelled into the space, right? It needs fire in its back end. That fire is its eustress. So you need that kind of fire to get you going. But when does it go towards distress? So for this part, when I talk about stress, I am primarily talking about distress. Okay? So this is an activity for you. Can you just give me few examples, few scenarios when you are feeling distressed or when you're feeling stressed? Yeah, please. Yes. Anticipating about future events. More expectations from self, very important. Anyone else? In the last 2 years, how have you felt distressed? When have you felt fatigued mentally? You must have gone through a tough time cracking this exam, right? One of the toughest time. Yeah. Yeah. Being preoccupied with your score, the national competition, right? It's a huge country. Yes. Very important. Not just for NEET exam, but for life. Log kya kahenge? This is the primary stress for most of the people, not leave alone the medical students. Yeah? What else? There was someone, yeah. Performance pressure for exam. Yes, that is primarily what you faced in the last 2 years. Comparing ourselves, having high expectations from ourselves. So, we get a lot of situations where we feel distressed. And you've been through one of the most stressful times of your probably life, as a student life at least. So congratulations on clearing that. But stress may come in other forms in the days to come as well. Okay? So what causes stress in our academic lives are mostly deadlines. We have this project to submit, we have that test coming up, post-end, internal assessment, university exams, and all those projects you have, right? Small or big. Deadlines cause a lot of stress. Competition. You're a batch of almost 250 students. There is an inherent sense of competition in you because you've competed against all of your batchmates throughout the country to get a seat in this college, right? So you are already in that competitive mode, which might just continue throughout your MBBS as well. And then there is always, like ma'am said, there is always this competition of NEET PG coming up, right? So competitions are there. We have our own frustrations, our day-to-day confrontations with our friends, family, faculty. We have so many things going on in our life. Our sorrows, and lastly, perfectionism. Like we said, we have high expectations from ourselves. We compare ourselves to others. We want to excel everywhere, which is good. Till the amount is reaching the peak to the optimal level, it's good. Yeah. Yes, of course. But what society expects from us is also our own perception. Society never dictated what you should do. You think what the society expects out of you. So most of it is probably going on here, inside us, right? Okay. So these are some of the common causes of academic stress that you are going to face in the coming years. Besides that, See, in our general life, these are some of the things that cause stress to us. First and foremost is the academic stress, of course. You being students in one of the most competitive field, in the most tough field, are going to face a lot of stress. That kind of pressure is going to create diamonds out of you, right? Occupational stress, being a physician, being a doctor, is one of the most stressful jobs, you might all agree, right? Is there any other job you think is very stressful? Do you think there is no other job that is more stressful than being a doctor? Anyone? Sorry? Entrepreneur? Yeah. Okay. Yes. That's a lot of pressure to deal with. Yes, yes. Of course. But that's just 1 in 4 years, 5 years, whatever. Not really. It's because their career is very short. We think it's a short-term stress, but the stress is real. So athletics is also also stressful. They have a lot of pressure. Yes. Oh my God, that is so specific. Be so specific in your answers as well, okay? Okay. So there are many stressful jobs. The job of a policeman, the traffic police, healthcare sector, obviously. So every field has its own stress, but we all are responsible how to manage our stress and our time, right? Emotional stress, of course, no one is free from that, right? No matter what occupation you're in, what field you're in, you'll obviously face scenarios, situations in your day-to-day life, within your family, within your friend circle, amongst your colleagues, which cause some kind of emotional stress. But you have a good company, you have a support system, which will help you fight that stress. Family stress, this like similar. There are situations within your family, someone falls ill, some new member comes into the family, and all that kind of situation. Physical stress, of course. Financial, very important. Within a few years, that's going to be a major stressor for you. Lifestyle and social. See, here are the two sources of stress that we have some control over, relative to the other forms of stress. So academic stress is more important for you guys, as you guys are going into a rigorous course of 4.5 years of MBBS. What kind of factors cause academic stress? First and foremost, like ma'am asked, is it by choice that you're here? It's good that you are, but many, let's say few of us have come here because of parental pressure. Doctor hi banna chahiye apne bacche mein. Right? So if you did not have a liberty to choose your career, that could be a form of stress. Peer pressure. This comparison of marks begins really early in our schools, which just keeps on continuing. And once all this is over, you'll realize, khamakha itna pressure dala tha khud. But this pressure, like I said again, agar you stress hai, to acha hai. If it's breaking you down, then you need to take a step back and relax. Achievement anxiety, the fear of failure. High achievers mein bahut zyada hota hai. I think you are the creme de la creme, even in the medical society. So beware of achievement anxiety. Poor performance in extracurricular activities could also be a source of stress. Now social stress, we'll just briefly go over this, like whatever comes from our social environment, our family, our friend circle. Everything can be a reason for social stress. This is a day-to-day life situation, okay? If you are a business owner, there can be a verbal aggression between you and your customers, or if you're working at a 9-to-5 job, it can be from your superiors or your colleagues, co-worker conflicts, right? And most importantly, politics. As in when you're growing, you will understand more and more what workplace politics is. No place in this world is free from this workplace politics. So you will probably get a shocker for this, but as and when you are working, you will get adjusted to it and probably overcome it. Yeah? Say 10 years down the line, you will have financial stresses, घर का rent, car loans. Married hai to run the family, everything, monthly kharcha. Say, God forbid, someone in the family falls ill, treatment ka kharcha and all that. Education loans repay karna, jo bhi hai, aage ke life ke liye. So, money is also very important, aage jaake at least. And not having enough money, at least for for the security purposes, like koi emergency वगैरह हो उसके लिए, तो भी that can be a kind of a stress. Your day to day, at least a small stress. Occupational stress can be, say for our field, it can be long working conditions. By the time you will be interns, you will be facing a lot of work related pressure. The working hours will be long. Working conditions, well. You might not have enough money to enjoy the way you wish to. Workplace conflicts among your friends. तूने कम ड्यूटी किया इसलिए मेरे को ज्यादा करना पड़ा. Might come. And then sometimes, unfortunately, there can be certain things like bullying. You may be facing people who are narcissists or psychopaths. Well, rarest of the conditions, but still there, possibility. Okay. So, narcissist is basically someone who is very self-involved. In very plain and simple words, it's someone who is very self-involved, doesn't recognize that others have a say or, cannot empathize basically. Me, myself. Some forms of emotional and mental stressors. Once we start having this first and foremost negative self-talk, we are already on the way towards distress. If we start comparing ourselves, if we start motivating or talking negatively about ourselves, derogatorily about ourselves, we are already on the path to distress. A lack of purpose in life can be a stress. Unresolved trauma. We have many tough situations going on in our life. If we don't resolve them and just brush them over under the carpet is going to, rise. The mountain of stressors is going to rise. So unresolved trauma can also cause a lot of mental and emotional stress. Relationship conflict. You will get into relationship, most of you. Usually it begins in the first year, here itself. Moving, changing jobs, divorce, much later in your life, but still a form of stressor. Loss of loved ones, big stressor. Constant stimulation. This stimulation is basically mental stimulation. Constant small worries. Small worries are the ones which actually affect us a lot. Smallest of the things, like if you're traveling by local trains, wo dhakka mukki. If you're driving to your college or wherever, home, that traffic is a small stress, Savere utha aur pani nahi hai nal mein, small stress. But these kind of small stresses add up and can take a toll. You might just end up bursting over someone else or some other place. Overextending yourself. So these are the forms of emotional or mental stress. Like I said, addition of family member, loss of family member, sudden change in income and your social status. Sorry, that should be status. So these can be sources of stress. If your family, there are some conflicts going on in your family, there is a constant stress at the back of your mind. कि ये चल रहा है घर पे. And ऊपर से तुमको पढ़ाई का pressure है. It just adds up. So what do you think happens to you when you're stressed? Yeah? Very good. Because of this graph, you can see your performance declines. Yeah? Sorry? Shivering, very important. I'll come there. Mentally unstable. Okay, we can just elaborate on that. Yeah. You're confused about what to do. Yes? Very important. Our decision-making capacity gets clouded. Any more responses? Yes. Displacement of your frustration or anger. Very important. It very commonly happens and at the most inappropriate places. We regret it later. So briefly speaking, this stress has a toll on your health, both physical health, psychological health, your behavioral, emotional and medical health can be affected. What are the physical symptoms? Can you just guess? This is just there for your guidance, like what all can be affected, but can you... Sweating, yes. Indigestion. Very commonly we face indigestion during our exams, right? You feel bloated, you feel breathlessness, you feel breathless during your exams, you feel coldness of your hands, yes. Increased heart rate. So these are the, yes. Headaches, yes. You overthink too much about your performance, about your results, you get headaches, you are unable to sleep. Unable to sleep causes another headache, so it goes on in a cycle. So, headaches, nervousness, sometimes you get fatigued, very fatigued, you just don't want to do anything because you're thinking too much. Yeah, sadness, anxiety, frustration, chhod deta hu sab kuch, nahi karna kuch. That kind of stress, forgetting things, difficulty in making decisions, these are most of the things related to the mind, the brain, nerves. But besides that, have you not had eruptions on your face because you're too stressed? At least your age. Acne problems, muscle pains. You might feel the tension in your muscles as well by the end of the day when you're just too stressed about studying and, the results. Like they've said, racing heart, increased blood pressure. You may also have increased risk of cardiovascular diseases, diabetes and all, if you're continuously stressed, if you cannot relax. In your upcoming lessons, you will learn that in your physiology lessons. Yeah? Even your immune system goes down. You will learn how, all those corticosteroids and everything, how stress affects your body. Then psychologically, like they've said, our decision-making capacity is clouded. Why? And memory problems are there because we cannot concentrate on what we are doing, right? Say you're attending a morning 8 a.m. lecture and you're already stressed about something going on in your home. Will you be able to grasp what is being taught in that lecture? You already had less sleep because of the tension. You're feeling groggy. You are having mild headache. You've not had your breakfast probably. And then you come and sit for a 1 hour lecture. You are barely there. You're just physically there, right? So difficulty in concentration, which leads to forgetfulness again. Confusion, like he said. Panic attacks, racing heart, shivering, feeling cold, clammy hands. Feeling hopeless about things, feeling like just chhod ke chale jaye. That kind of frustration. Worries, restlessness, fidgetiness. These are all symptoms that you may face when you are distressed. Your sleep is affected. If you get insomnia, obviously, if you keep on thinking about something, you're stressed about something, you will not get proper sleep at night, which is insomnia. And if you've not slept at night properly, you will be drowsy throughout the day, right? Your appetite is affected. You either go into an increased appetite mode, you have craving for carbohydrates, or you have a loss of appetite, you lose weight, or you gain weight as per your appetite changes. Here is something very important. Most of us resort to some kind of maladaptive options to temporarily bust stress. The kick or the feel of relaxation when you have alcohol or a cigarette. It can give you some temporary relief, but mind you, it is going to harm you definitely. For some temporary relief, you might do more harm to your body. Okay. Besides that, absent-mindedness, anger outbursts, these are common behavioral changes that we see when we are distressed. Right? Emotionally, when you're stressed, do you feel all this? Have you felt that you're too tearful for no reason, or koi choti si baat hogi and you just burst into tears, especially just before in the 2 months preceding your NEET? Did you ever feel that? Ki mummy kuch bhi bolti hai and you're on the edge and you just shout back at mummy? Yeah? So mood swings, sadness, tearfulness, restlessness, irritability are very common when you're distressed. It gets displaced on the wrong person at the wrong time. Yeah? Medically, these are the conditions that you may develop when you're continuously in a state of distress. Hypertension, diabetes, low immunity. What does low immunity cause then? Diseases is very vague, but yeah. Infections, right? You're very prone to infections. Skin conditions like acne and hair loss. Have you faced hair loss? Yeah? Before the exams? Gastritis. How many of you faced gastritis? Just one. Itna stress liya tha. I'm sure most of you have. Yeah? Indigestion and gastritis very common. Migraine headaches are some of the medical complications that you may face. So how to manage stress is today's objective. And for the stress management part, I would request Dr. Shilpa Adarkar, madam, to come on the dais.
What causes it? What is stress? And we also learned what are the effects. And we don't want those effects. We want to prevent them. Right at this point, we want to tell you that this is stress and distress. This is what happens. We don't want it to happen when you go ahead from here. So how do you manage this? Do you relate to this? 8 a.m. lectures. What time they keep lectures? How do you reach at 8 o'clock? Then there are clinical postings where you have to, go into the wards, OPDs, take cases, present them. Then they have log books. You have submissions of those. Then maybe you have to travel back and forth because you are staying here somewhere far. If you are living far, then maybe you have to go home in between because that also is important to go and meet family. Your roommates could be an issue. Exams are always there. This is not like one NEET exam that we had. Like एक ही लक्ष्य था ना अभी तक एक NEET exam crack करना है. अभी ऐसा नहीं होगा. अभी every now and then there will be one exam. Okay? And they'll keep coming. And they have different names. NEET was one capital NEET. Forget about it now. Okay? There'll be vivas, there'll be practicals, there'll be tutorials. They call continuous assessments. They call term end exams. And then we also have other things going. We have college festivals coming up. Our college ka festival, dusre college ka festival, udhar competitions. Right? And there'll be many, many more things. I may have missed some things that will come up later. There'll be relationship issues, there'll be friendship issues, there'll be competitions. So how do you manage? Who said MBBS was easy? How will you manage it? How do you manage otherwise? I'm sure some way or the other you do, some ways do you do employ your own ways. Right? How do you do it? How did you do this last whatever years? I cannot imagine this. My time there was no NEET. I was lucky. I really can empathize with you all, the kind of pressure you had and the kind of competition that you went through. It's really cruel. But you managed. How did you do it? Can you spare some tips? Yes. Talking to parents, very good. So in between you kept talking to them whenever you felt stressed. Yes. Used to take a nap. Wonderful. So just stay away from it for a while and come back and revisit it. Yes. Excellent. So you would laugh. you would listen to those watch them and just laugh. Listen to music, very good. Meditation, excellent. Did you practice it? Okay. Yes. Cartoons. So basically you saw something or watched something which made you laugh, right? Yes? Sorry? Don't let them intrude. Let go. Yeah, so either journaling, write something, or go and talk to somebody. So let it out. Right. Have a hobby. So what hobby did you pursue? Painting, excellent. So I think there are a lot of things that you people already tried in order to deal with your stress. Okay, which were good, which helped you. So what we are going to do here is just go through a few similar tips. We'll put them together. So this will be like a revision. So these are the things that are important in stress management. Self-observation, cognitive restructuring. I'll explain all this. Don't go by the big words. Relaxation, time management, and problem solving. So by self-observation, what we mean is being aware of one's emotional state or one's responses or the way we react. Okay? Many a times we are not aware, we just react. And then later ऐसा लगता है अरे क्यों इतना गुस्सा किया? अरे क्यों इतना? अभी now when you look back, I'm sure you think of the times when you went through a lot of anxiety. Was it worth it? It wasn't, right? So if we are already aware every single day, every time about our emotions, about our responses, and either we make note of it somewhere or in your notes or journaling, as somebody said, that today I felt very angry. This teacher said this and then I felt like this. He or she always speaks like this. But she or he scolded the whole group. So it was not something personal. And what we need to learn is what she scolded for. And okay, this was the problem. We need to correct it next time. Instead of taking it personally, feeling sad, why did she say this? Why did she or he always say to me only? That is our reaction, usually, right? So we need to be aware of our responses or reactions. In cognitive restructuring, there are 4 steps. Now, what is this big word cognition? Cognition means our way we think, our thinking or thoughts. Okay? And the way we think determines how we will respond. Isn't it? So we have a thought and that leads to this emotion, whether it's anger, whether it's fear, whether it's panic or anxiety. So we need to first know that, then we need to monitor and analyze it. Most of the times if we sit and analyze, we realize that there is no logic in it. For example, there is a painful medical procedure that I have to undergo. My thought is, I know I won't be able to tolerate the pain. I have heard it, it's very painful. So the emotion that I have is fear. Oh my God, what will happen? Right? But there is no point in it because it doesn't have to be that way. They might give you a local anesthesia and do it. People take care. They don't do procedures just like that for giving you pain. Or if you had an argument with a friend, she will never speak to me again. I know that. It is such a disappointing thing. Or discouragement. So whatever the emotion that you feel after that thought is disappointment or feeling down. Or if you are late for a deadline. So the thought is, it's hopeless. I'm always messing things up. I'm never on time. This happens with me always. Now I know that ma'am will shout at me. And then this will happen. And these batchmates of mine will give it in time and only I'll be late. So this will lead to sadness or depression. So it is our thought, which may be illogical or irrational, which will lead to this emotional response of us. Right? So what we need to do is challenge it. How do we challenge it? Is there an alternative explanation? Or this is the right way that I am thinking? Okay? What is the evidence that this is true? So many people undergo this medical procedure. They go through it. They take an injection. Doctors take care of that pain part. So why am I saying this? That it is painful, so I am scared. then what is the effect of continuing to think this way? If I continue to think this way, is it going to help? Would it help? That's the question that you have to ask. And what will be the outcome and what is the likelihood of that outcome? If the outcome by being fearful is going to be you can't have that procedure and finally you will suffer that problem. Or if you are going to think that I had a fight with my friend so he or she will never speak to me. Instead, is there any better explanation? Is there something else that we can do? So that is challenging these distortions and then changing these distortions. These are the steps in this big word cognitive restructuring. So how do you change it? Suppose I say it's not fair that I am being treated this way. They always say this to me, or I am always getting this unfair treatment. So the rational response is life is not always fair. Sometimes things go my way and another time they don't. That happens to everyone. So it's not something personally somebody is attacking you. Okay? Or no one really cares about me. If something goes wrong, many a times our reaction is no one really cares about me. Right? So it's not so. There are a lot of people in life who care about you. And you can turn to them for support whenever needed. Right? So this is the way you change those cognitive distortions. So first, understand that our cognition or thinking leads to our emotional response. Then, what are those cognitions or irrational or illogical thoughts? Then, challenge them and then change them. If we have this habit of doing this, we will think more and more rationally. We will not give these impulsive emotional responses without thinking. Okay? Then the third part is relaxation. Many people said meditation, music, all that was to relax, right? And there are certain specific ways of relaxation also, which Dr. Kaninika is going to take you through at the end of this. So what it does is, when we are relaxed, we are not anxious. Okay? This is a rule. There is reciprocal inhibition. When we are relaxed, we cannot be anxious. And because we are relaxed, we are able to think more rationally. Our negative emotions get restructured, what we saw earlier in that table, that we can think more rationally. Our thoughts can become more logical and rational, and we are able to make decisions better when we are in a relaxed state. So because of that, when she takes you through that relaxation, you should try and practice it every day so that you are there in that state more often. So that you are able to think rationally more often. Okay? Very important part, especially for y'all, is time management. Right? I'm sure you did it in the last 2 years also, that ये इतना टाइम ये पढ़ने का, फिर उतना टाइम ये पढ़ने का, फिर ये टाइम वो क्वेश्चन सॉल्व करने के लिए है, ये सब टाइम मैनेजमेंट किया होगा. But now there are 100 other things. It is not that the range has widened, right? So how do you manage time? First important thing is we have to be aware how we manage our time presently. Okay? So if you have that awareness, then only you will make changes in it and manage it better. Isn't it? So you should be aware. Otherwise क्या होता है, हाँ उठते हैं, फिर अच्छा इतना बजा तो चलो लेक्चर मिस हो गया, चलो अभी कैंटीन में बैठते हैं, फिर उधर बैठे तो 2 घंटे उधर ही बैठे पता ही नहीं चला, फिर किधर जाके लेक्चर में गए तो आधा अटेंड किया नहीं किया, फिर दोपहर को प्रैक्टिकल था, फिर उसमें गया, फिर उसके बाद चाय पीने बैठ गए, हमको पता ही नहीं चल रहा है टाइम कैसे जा रहा है, तो इट्स डिफिकल्ट टू मैनेज टाइम. राइट? फिर शाम को डिनर के बाद बैठ गए, कोई कुछ बिंज वॉचिंग कर रहे हैं या कुछ चैटिंग चल रहा है या कुछ और देख रहे हैं या अपने सोशल मीडिया अकाउंट्स पे इधर उधर जा रहे हैं, तो पता ही नहीं चला 12-1 कब बज गया. फिर कैसे उठेंगे 7 बजे? राइट? सो वी हैव टू बी having enhanced awareness of our current pattern of time use, and then we have to set priorities in terms of urgency and importance so that we are able to manage it better. So for that, this grid helps. So urgent on one side and important on the other side. So if something is urgent and important, you have to do it now. Because it's not only important, it also is urgent. Right? But something that is important but not urgent, you can decide to do it later. So you can schedule a time to do it. Right? If something is not important but it's urgent, so you can't clone yourself, so you can ask somebody else to do it for you if that is possible. But if it is something that is needed to be done by you, then maybe you will have to again set priorities that in urgency, what is more urgent, what is less urgent. And if it is not urgent and not important, then ideally it should be eliminated. It need not be done. And most of our time, I think, goes in what is not urgent and what is not important. Right? If you go through your day. Just go through your day in your mind and then you'll realize that so much time is just going in a lot of not urgent, not important things. So if you set your priorities like this, you will be able to manage your time better. Also, when you set your goals, you can't say that, अच्छा ये 1 साल है ना, तो 1 साल में मैं अनाट फिजियो बायोकेम पढ़ लूंगा. That is too general. या if you say कि अभी एग्जाम्स दिसंबर में है तो 1 महीने में मैं फिजियोलॉजी के इतने चैप्टर्स है पढ़ लूंगा. It is very general. Your goals setting has to be very specific. So you have to be smart at it. It has to be specific. That I will finish 5 chapters or 2 chapters in 1 week or something like that. It has to be measurable. So what do you mean by measurable? The number of pages or number of questions that come under that much has to be covered. Right? It has to be achievable. You can't say entire book in 1 month. Right? Be realistic. So you cannot have unrealistic and not achievable goals. And they have to be timely. So if you are smart at setting your goals, then the reward, the joy of achieving it is really nice because you set a goal which was measurable and specific and you completed it in that much time. And you were able to answer whatever comes under that, whatever long questions, short questions are under that chapter or under those 2 or 3 chapters. Achieved, feel rewarded. Okay, so your goal setting also has to be smart. And our way of coping with anything in life, including studies, exams or any other thing, has to be problem solving. We can't just sit and cry or just avoid it, nahi jam raha hai, or blame somebody. All these are not good coping mechanisms. We have to be focusing on problem solving, for which we have to identify the problem. Right? Many times we are worried about non-issues sometimes. Actually, there is no issue, but you are just sitting and worrying. So either there is no issue, or if you think there is a problem or an issue, figure it out and then generate alternatives. What could be done? What are the possible solutions? A, B, C, D, whatever numbers that come to your mind. ऐसा कर सकते हैं या फिर ऐसा कर सकते हैं या फिर ऐसा कर सकते हैं. ये किया तो ऐसा होगा, ये किया तो ऐसा होगा. And then find the best solution and implement it. For every small problem or big problem, if you have this way of problem solving, you will never be stuck and you will never be worried about non-issues and non-problems. Okay? So, self-observation, cognitive restructuring, relaxation, time management and problem solving. Okay? And then there are simpler methods which have to be done by all, not specifically medical students, but all the more reason for medical students because skipping breakfast, not having something, not having a meal, it's very common. In fact, life ahead is going to be tough and you have to build your immunity, right? So for that, you need to eat well. And eat well doesn't mean keep on ordering on various apps. Nutritious diet. Okay? You can always treat yourselves in between. So for 1 week, if you have followed properly, on a weekend you treat yourself, fine. But that can't be an everyday thing. That junk food can't be an everyday diet. Okay? And having a physical activity, whether it is, if you play a sport, excellent, continue playing. There are options here also in the campus, right? So continue playing, whether it's badminton, TT, tennis, cricket, whatever, or at least have a jog, do some other way of exercise. I don't know if you have, that yoga lecture has happened. So we have appointed a yoga teacher. We have somebody has donated for this activity. So Psychiatry department has appointed a yoga teacher who can help you in learning yoga. If you already know yoga, then it's fine. But if not, you can learn it and practice it. That is also one form of exercise, and it's very calming also. Okay, so that will also help. Having friends, as somebody already said, I would talk to somebody, listen to something, stand-up comedies. All this is very important. Because when you laugh, you relax. When you relax, you are in a better state of mind to make decisions or look at your problems, revisit your problems. Okay? So, having this good set of friends, not comparing marks and tere ko kitna mila, mere ko itna mila, not ye sab. Besides all that, you can have just plain, simple fun with friends and keep your sense of humor alive. Many a times if somebody is bugged with you and you say something and that can just, make that environment a little humorous and funny, and the tension goes away. Even if somebody blames you of something, or there are a lot of people from outside maybe who may have language issues and somebody comments on your language, for example. Okay? ये भी बोलने को नहीं आता है, ये ऐसा क्या बोलता है या बोलती है. You said, I think I'm not very good at it. Do you think I can take tuitions from you? Or do you think you will teach me how to say it or something like that, so that it just pacifies the whole thing instead of saying ये ऐसा कैसे बोला, ये मैं भी नीट करके ही आया हूँ, मेरे को लैंग्वेज के ऊपर कमेंट्स कर रहा है, ये ऐसा सब होके environment tense हो जाएगा, right? So use humor whenever possible. Being assertive is very important. Dr. Nishan talked about sometimes you resort to maladaptive behaviors like resorting to drugs or smoking or something like that. So being assertive and saying no is very important, and we need to learn it. And for being and other times also, like somebody's bullying or somebody's really troubling you, being assertive is very important, and that assertive is not aggressive. So you have to understand the difference. Okay? You don't have to shout or scream in order to put your point across. You can be assertive enough and still put it across. Being passive also is not good. If you are just passive and not saying anything, just listening or just tolerating everything, that is also not good. And being aggressive is also not good. You have to be assertive. Take time for self. So at least few minutes every day, once in a week, do something for yourself. Maybe treat yourself to the food that you like, or go on a picnic once in a while, or play that sport. Treat yourself to something. So that is also important. This is just 4 weeks. I don't know how much you will be able to do this, but it takes 28 days, and if you follow it for 28 days, it will become a habit. What is important is whether you will be able to follow it for 28 days. So first week, digital detox. That means रात को 8 बजे से morning तक no screen. I don't know whether it's possible. Maybe instead of 8 p.m. you can start 10 p.m. or 11 p.m. or something like that, and till morning. Don't look at the screen, because that screen is sending those stimuli in your eyes, in your retina, in your brain. Your brain will not be able to sleep. Okay, a lot of people do this. A lot of patients who come and tell us कि नींद नहीं आती है. क्या करते हो? नहीं, फिर नींद नहीं आती है तो मोबाइल लेके बैठता हूँ और ऐसा ये देखता हूँ वो देखता हूँ. तो अगर मोबाइल लेके बैठोगे तो नींद आएगी ही नहीं, because it's stimulating your eyes and it is in turn stimulating your brain. Then diet, as we already said, at least 5 minutes of relaxation every day, and if you practice this for 4 weeks or 28 days, it will create a habit. Certain things, we've already said this, are a no-no. Like smoking, drinking, taking pills or something to relax. But some people also, resort to things like just eating too much or sleeping too much. Some people say, when I'm stressed, I need to eat. Okay, so just going on eating junk food will not help. It will lead to weight problems and it will lead to maybe acidity or other GI issues. Okay, or just sleeping too much, just not attending. नहीं मुझे मूड नहीं हो रहा है, मैं आज नहीं गई, फिर आज नहीं गई तो कल भी सुबह उठने का मूड नहीं किया तो मैं सोती रही. Sleeping too much is also not going to solve your problem. Taking out the stress on somebody else, snapping at people, कोई आया पूछने को तो भी उसके ऊपर चिल्लाने का, that is not going to help. Or your many a times it comes out on parents and family members. It must have happened during the last 2-3 years. समझ में नहीं आता, इतना पढ़ रहा हूँ और ये नीट का क्या टेंशन है, क्या पूछ रहे हैं बीच बीच में, या क्यों इतना खाने के लिए परेशान कर रहे हैं, खाऊंगी ना बाद में, ऐसा हुआ है ना. So snapping at others is not going to help. It's a negative coping mechanism. Withdrawing from friends or just procrastinating. हाँ मैं ऐसा कर लूंगी, फिर ना मैंने ऐसा तय किया है कि फिर first of this next month ना I'm going to start this. And then when the first comes you say नहीं, फिर ये birthday party था ना किसी का तो अभी मैं next week से चालू करूंगी, फिर ये हुआ ना तो फिर मैं, सब procrastination ही चलते रहता है, वो actual कभी होता ही नहीं. तो these are the negative coping mechanisms. So in a nutshell, I don't think I'll go through it because this is A to Z here, but this is just a revision of things that we have already said. So I will not go through this. What is most important is enjoy each day. It's a gift. Smile and be thankful that you're a part of a bigger picture. Now you are a student of GS Medical College and KEM Hospital. You are the face of it. How you behave, how you perform, especially when you go into clinical posting, how you deal with patients, when you become interns, how you treat them. Everything is KEM ka student, KEM ka intern, right? So you're a part of a bigger medical fraternity now. And you have been given this chance, you're lucky, you are here, so enjoy it. Because these 5.5 years will never come back. Okay? Don't ruin them by worrying about PG NEET and small exams, and then you will go through it. Every one of us went through it. So even you will go through it. I understand that doing a PG is also now difficult. There's a PG NEET. But don't ruin these 5.5 years for that. Do that also and this also. You'll have to strike a balance. Okay? So I'm sure you will do your best to manage this, whatever stress that you go through. Thank you.